And opinions expressed during the related show are those of the show personalities and guest alone, and not those of Vic Canellis Media Group, its parent, affiliates, or stations. VCMG Live is not responsible for any content, information, or opinions expressed. User bears full responsibility for their reliance on such content, information, or opinions.
Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Welcome back to another episode of You and Your Doctor, sponsored by All County Healthcare. We are a certified home health care agency, and we are servicing Miami-Dade, Broward, and Palm Beach County. You can reach us directly at 954-717-7027. I am your host, Louise Gomez, and I would like to introduce everybody to our dear friend, Dr. Bilga Attar. And she is a board-certified family physician. I'm going to give you the number to reach her at. You can call us directly. Why don't you jot down the number, 954-717-7027. Thank you for coming on the show, Dr. Attar.
Oh, my pleasure.
You know, we appreciate you coming back and educating. Every time you come on, we always have a great conversation. And we learn a lot about different components of health and even at different stages of life, I should say, right?
Yes, yes,
So go ahead.
Well, thank you for inviting me again. I wanted to talk a little bit about health and wealth for long term.
Mm-hmm.
And our assets, of course, the biggest asset we have is our health. So I wanted to talk about that a little bit.
Yeah.
And then wealth management, that comes later, but it's very important.
I would say it's very important because if we don't have those in place, that can cause stress. Inevitably
Absolutely,
will affect our health.
Insomnia,
Yeah.
hypertension. Yeah. But mostly when we're getting into our senior years,
Mm-hmm.
I think we should be more responsible for our health.
Yes.
We're not as young anymore,
That's right.
but we should keep up our health and good healthy habits. I was thinking of, in my training, we took care of from birth to death.
Mm-hmm.
But seeing your physician on at least several times a year would be advised.
Yes.
Yeah. And if one has a health problem, even a minor health problem as we get older, or hypertension, it's not just hypertension,
Right.
but it could involve the brain, the kidneys, the heart. So your physician has to manage your care, your total care,
Right.
every time you visit them. You know, maybe at least once or twice a year minimum. And then we have healthy woman exams, which includes pap smears, mammogram,
Sure.
eye exams. All of those are just continuous healthy exams, we call it. Healthy habits, I guess
I was
most
gonna ask
everybody
you,
know about that.
What are some healthy habits that we can incorporate at home on a daily basis or a weekly basis? What are some
Okay,
things
well,
that you would recommend?
We can start from the eyes, for example.
Okay.
Very important to get an eye exam at least once a year, if not twice a year. If you have glaucoma, of course, that's going to be more often. Let's go down to our ears.
Okay.
Very important. We have patients that come in with vertigo. First thing we check is their ears. Maybe there's impacted cerumen, which means wax, and that will cause
Dizziness.
problem with vertigo, which is when you get up out of bed and you turn your head, things would be spinning, which is different than being lightheaded.
Sure.
So a good it's a good thing to go to your family physician or your primary care to look into your ears and eyes and etc. You'd be surprised when you have your ears cleaned how well you feel, and sometimes the vertigo goes away. But sometimes it needs more intense exam and treatment. All right, then and the hearing is very important.
Sure.
When you are at the ear, nose, and throat specialist, they do give you a hearing test. And as we get older, that goes too. So we need to be careful with the ears hearing. Then the oral cavity.
Yeah, I was going to ask you about that.
Yes.
Because I know they would talk a lot about how our dental and oral health is related to maybe heart disease. So if you could speak into that.
That's true. When we are, it's very important to keep your oral hygiene every day religiously by
That's right.
brushing, flossing, and seeing your dentist, at least for oral hygiene and cleaning, 3 times a year, and having a good thorough exam, oral exam.
Right.
And also this way we catch oral cancers. And the oral hygiene, we see sometimes at the hospital or when we admit a patient in sepsis and we find, we're looking for a source. And sometimes it would be the mouth.
Right.
We have a lot of streptococcus, and which could invade the mitral valve and cause endocarditis, etc. So oral hygiene, your dental follow-up visits are very important.
Right.
And let's now get down to the vascular part. That's the hypertension, heart disease. Again, your family physician is equipped to diagnose you and take care of you. We may also have to refer you to a cardiologist for further evaluation, which may include echocardiogram. It might be carotid ultrasound, etc. So the vascular also, just beside the heart, we look at the peripheral vascular problems. And here comes the healthy part, healthy living, is you have to stop smoking.
Yes.
Because
absolutely.
smoking will affect all your vessels,
Right.
your heart, your lungs. Everyone knows lung cancer, etc.
Sure.
A COPD. You don't want to be walking around with an oxygen tank when you're 70s or 80s.
Absolutely.
Bad quality of life.
Yeah, and there's a lot of young kids I see still vaping. It's just ridiculous to me.
I know. And they think it's cool,
Right.
but it
It's
really
just-
is not
yeah,
cool. It's
no.
in fashion today and not in fashion 10 years from now. And they'll regret it.
Yes, absolutely.
They will regret that.
Absolutely.
So then we come to our endocrine diseases such as diabetes, thyroid disorders, and there's many other disorders, but most common is the diabetes and the thyroid. So again, your family physician is trained to help you diagnose and treat your diabetes and the thyroid disorder, and we may have to send them to an endocrinologist if need be. And weight management, nutrition is very important with that.
Absolutely.
Now, diabetes is not just blood sugar control, but it affects the peripheral vascular structures and your heart, and your kidneys for sure.
We're all interrelated.
It's all connected.
It's all connected,
Yeah,
right?
yeah. And your physician has to monitor your kidney function and your peripheral vascular structures, because there are a lot of complication that goes along with diabetes. It's not alone just controlling your blood sugar. When blood sugar is not well controlled, there's an increase in triglycerides, and some of the diabetics get cirrhosis of the liver, which is
interesting.
non-alcoholic cirrhosis of the liver. It causes fatty liver.
Right. Oh, so
with
that's
poor
from an
diet.
unchecked blood
well,
sugar level.
Well, yeah, we make sure the blood sugars are well controlled, and we do a lab test called hemoglobin A1C to see how well it's been controlled for the past couple of months.
Okay.
And we'll sit down and talk with the patient for better diet. And we have dietitians that'll help with that as well. And then we have other diseases that come along as we grow older. Cancer is one. So early detection is very important. This is where your colonoscopy comes in handy.
I was going to ask you that. At
Yes,
what age is a good
yes.
age to get that done?
We start at, don't quote me, at 45
about.
years of
Okay.
age.
Yeah.
But it's very important for your family doctor to check CBC with differential, we call it, just to see if you're anemic or not, and then go from there to have a further evaluation. But colonoscopy is just like in the same category as mammography, pap smears,
Sure.
colonoscopy, carotid ultrasound, echocardiogram, as we grow older. Not when you're young so much, but it depends. Cancer is a big one.
It is.
So early detection is the best treatment. And going in for these scheduled, recommended tests, such as colonoscopy, mammogram, on a mammogram yearly basis.
And the dermatologist too, right?
Oh,
to
absolutely.
check
The
those-
skin is very important, especially here in Florida. So we need a good skin exam, whole body.
Right.
I had one patient when I first started, and he was from one of the islands, dark skin, and he came in with a lump in his groin. And I said, oh my goodness, this looks like it's not a hernia, it's hard, but let me get an ultrasound, etc. Ultimately, I sent him out for biopsy. It came back malignant melanoma.
Wow.
So on a dark skin, you can't see that. So I looked all over and I couldn't see it. And finally, I had him take his shoes and socks off, and I looked at his feet in between the digit, the toes. He had a melanoma growing,
Oh, wow.
which metastasized. And I could never forget that patient. And I had another patient who came in for a cold and a cough, and he sat down. I said, well, can I listen to your lungs? He said, sure. So I said, I'm going to lift up your shirt to listen to your lungs. And he got very angry.
Really?
And he was from Canada. Not that makes a difference, but I said, I want to see what's going on in there. So I listened to his lung, and I noticed that he had an irregular lesion on his back. And I said, did you know you have this lesion? When was the last time you had your checkup? He said, no, I haven't been to a doctor in years. I said, you need to have this checked by a dermatologist when you go back to Canada. He said, oh, okay. And then I got a letter a month later thanking me over and over again that it was a malignant melanoma.
Wow.
Yeah. So the skin check is very important when you go to a doctor's office, from head to toe. We have a lot of skin lesions on the scalp, especially if you are a boater and you're on the boat all the time. We see squamous cell cancer on the scalp quite often.
Wow.
So,
It's
and
important.
those other lesions that you never think of looking in between the toe webs,
Right.
that there is something there that. So it's very important to have a full exam.
Absolutely. And let's talk about other things that we can do as part of we spoke about, good habits. What about food and things like that we have control over at our own home, right?
Well,
We have a quick commercial break. When we get back, we'll talk about
All right,
other
that's
things
fine.
that we can do at home. Stay tuned, everybody. We'll be right back.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027. Or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Thank you, everybody, for tuning back to our show at All County Healthcare. We have Dr. Bilga Attar. She's a board-certified family physician, and you can reach her at 954-717-7027. So, Dr. Attar, we were discussing, I guess, things that we can do that are in our control. Like, what do you talk, like, as far as food and diet, what do you recommend to your patients?
I think it's so, everyone most likely know all this. It's your diet and exercise.
Yes.
And then the healthy habits, the big ones are the smoking, stop smoking, and alcohol. We see their effects later on in life.
Yes.
With smoking, not just lung cancer, but a slew of medical problems that goes along with smoking. And with alcohol, it's the same thing. The alcohol turns into triglycerides in the liver very quickly.
Because some people say, oh, I only have a glass of wine 3-4 days a week. But over time, 20, 30 years, that 3-4 days a week, it's kind of like a compounding effect.
Right. And when we check a patient's blood count and we see that their triglycerides are high and they're young and they don't have diabetes, and quickly we think, is there alcohol in there? Because the alcohol is metabolized quickly, and it goes into the liver, causes fatty liver, cirrhosis of the liver.
Right.
And after cirrhosis, problem after problem after problem until the patient dies.
Wow. Yeah.
It just goes up this way, the problems.
Yeah. So over time, drinking is not, they may say, a glass of wine, but not so much.
No.
Not so much.
And as far as diet, just being careful about how much you consume and what you consume. I'm not a fan of red meat myself. I haven't been since 1984. I think that was after my anatomy class. I said,
you were done with the red meat.
Yeah, of course. I mean, I know it's not a very good thing to eat. But if you can limit your red meat to a couple of times a week, if you have to. And I would not buy processed meats such as hot dogs and bologna, salami. I think these preparations were done in the old days to keep spices and meat fresh because we didn't have refrigeration.
Right.
So I don't go there at all. Of course, the best foods would be vegetables, fresh if that's possible.
Sure.
Fruits, grains, whole wheat flour, but limited. And I sometimes use quinoa flour.
Yeah, quinoa is good. I like that.
Yeah, but the flour, I use that flour to make pancakes.
Nice.
Or waffles. So that I would say the way you prepare your meals is important too. Deep frying is not the best. You can air fry, it's okay, I guess.
Sure.
Grilling is okay. Fish is the best. I mean, fish and chicken, and not fried chicken,
Right.
but grilled breasts of chicken, and the least fatty part of the chicken is very good.
Yeah.
I'm very careful about what I buy, and shrimp once in a while is okay as well.
As long as it's not farm raised, it's wild caught.
Yes.
Right? Same with the salmon, wild caught.
And I would say they talk about Mediterranean diet everywhere.
Yes.
I do use olive oil. I don't use butter at all, if I can help it.
Right.
So we use a lot of vegetables. I mean, I grew up in Turkey till I was 10 years old, and I came to this country about 10, 11 years old.
Yeah. So you were eating real food. Great
real
food.
real food, real chicken, and in those days everything was farm.
Sure.
Produce was fresh. When I came to this country, well, there was pizza, and there were donuts. I said, "Wow!" You know, but and cakes. I didn't care for cakes too much, but anyway.
It's really maintaining. We know, like when we go to the supermarket, when we're eating, it's just really maintaining those habits. You know, creating those habits and not deviating, because it's easy to deviate with the cakes and the sweets. So
cookies and cakes and ice cream, it's easy. I mean, if you have to have ice cream, just a little bit in moderation, everything, it's okay once in a while.
Sure.
I buy the yogurt ice cream. Sometimes it makes me feel better, but not every day.
Sure.
You know.
Dr. Attar, I wanted to ask you about insurance, because it's so confusing, and when people, you know, are older and they get the Medicaid Medicare, and what can you speak into and share with us about insurances?
Well, insurance, the best, in my opinion and in my experience, I can talk about that.
Sure.
I feel that Medicare is the best insurance still.
Okay.
And then Medicare only pays 80%.
Right.
And there's the 20%, which is a supplement, must come out of your pocket or from a secondary insurance.
Okay.
Again, for myself, I talk for myself. I decided to go with AARP. Through AARP, I'm a member.
Okay.
And they have insurance companies that covers the 20%. And I chose United Healthcare for the 20%. It's a little bit costly, but you pay at this end, you get the benefits at the other end.
Right.
So I bit the bullet and
Good
got
for
the
you.
best. Yeah.
Good for you.
Yeah.
So that extra 20%, people have a choice.
Exactly.
You chose AARP to go through.
Well, I was a member of AARP. That's a huge company, but they offer different types of insurances at a maybe better rate. So I chose their United.
Good.
And United has different portions. You know, some of them you have no copays. That's mine. And some will have so much copays and so much copays and what's covered, what's not covered. But I just didn't want to deal with any of this, and I just got the best.
Good for you.
So
People
I
want
don't
to
want to deal
that.
with copays because I know if you go into a doctor's office, who knows, you may end up with an MRI, CAT scan,
Sure.
and that costs $1,000, $500, whatever.
Right.
But now if you have the best plan, you will not have to pay out of pocket so much.
Well, that's good to know.
Yeah.
People want to know that.
Yeah, you can rely on that.
I know you also want to talk about health and wealth,
Oh, yes.
and you wanted to discuss a little bit more about that. We actually have 2 minutes left, so please share what you'd like to share about.
I had a very good accountant, and he was also a financial advisor. I didn't know that, but of course, when we graduate from medical school, we are zipped with business or financial advice. So he walked me through it all these years, past
Nice.
25 years.
Very
He
good.
was SEP IRA, annuities, and bonds. I had no idea what they were. And finally, I did learn what they were.
Good.
Eventually. So I made good saving my
Good for
money.
you.
You know, you just save so much a year, so much this, so much, just a little at a time. And it builds up over the years. So you
Yes.
have to have that cushion, security
Mm-hmm.
of being financially set when you're 80 or in your 70s and 80s when you're retired.
Sure.
You depend on that. So you need to get a good accountant, financial person, try to understand what they're saying,
Mm-hmm. Mm-hmm.
get it through your head.
That's right.
Not like me. It took me a while to get it through. And then now I feel very good about looking into retirement eventually.
Good.
But I don't think I'll ever stop working, to be
I know,
honest.
because you love what you do.
Yes, I do.
You love what you
Mhm.
do. Well, thank you so much for coming on the show, Dr. Attar. It's already gone so fast, so we appreciate you coming
Oh,
on and
sure.
sharing all your knowledge all the time. It was a pleasure.
Same
Thank you
here.
so much.
You're welcome.
Stay tuned, everybody. We'll see you next week. Take care. Have a great night.